The society, and indeed the world we live in, is made up of people with different behavioral traits, which is a function of family background, peer influence, as well as experiences. These all add up in making an individual what he or she becomes, good or bad-natured. In recent times, just like Nigeria and other countries of the world are battling to contain the spread of the coronavirus, the cases of rape and other forms of sexual assault kept rising in the country. What makes it very worrisome is that even minors are not spared. So on this episode of Frontiers, the focus will be on the rising cases of sexual assault. I am Obiageli ugwoke. Our guest is Princess Modupe Ozolua, founder, Empower 54, and special advisor to the Deputy President of the Senate on Non-Governmental Organizations and Disabilities Affairs. Glad to have you on the program.
Thank you for having me.
The program continues shortly. Princess Modupe, once again, you're welcome to Frontiers.
Thank you for having me.
Now, your organization has been working with communities, trying to find solutions to a wide range of societal problems. How would you describe the experience?
Very disturbing in the sense that as much effort that the government is putting in, and also those of us from the non-profit space, the NGOs, etc., and also individual philanthropists that do things on their own free will, the impact still is not truly felt. It's quite disturbing because it shows that there's a great disparity between those that have and those that don't have. Because if that's the case, when you look at the numbers, the figures that the government is allocating for different services, be it health, education, etc., still compare that to how many uneducated children we have. Let's talk about children, let's not even talk about adults. The rates are ridiculous. The government does come up with different initiatives, feeding children at schools to encourage parents to send their children to school. But how many of them still send their children to school? Some of them send them just so they can have a meal to eat because there's no food to eat at home.
Because of the school feeding program?
Yes. So that has helped at least feed people, but to what extent has they actually put children in classes to learn? Now that's a whole different story. And then you look at us from the nonprofit space, the millions of dollars, pounds, euros, etc., that's being put into different communities for the same, it's always the same causes, health, education, empowerment, etc. But yet, you look and you still cannot see the impact. It's the same thing like when you go to the Northeast, you go to Bondo, you look at what's being done for IDPs. You cannot actually quantify the amounts of monies that have been put into IDP-related programs, but yet, there's still nothing to show for it. So these are factors that does make you wonder, what are we trying to do? What are we doing that is wrong? How does one even change the narrative to even see any changes at all? So it can be quite discouraging, quite honestly.
Now, in your involvement with these communities, what problem or societal challenges do you find more predominant?
Empower 54, we work in Nigeria, we work in Democratic Republic of Congo, and I can tell you something, the problems are always the same, everywhere. It's just some places have more of it than others. It's always hunger, it's always gender suppression, women are not encouraged to be productive, economically productive. It's always lack of education. It all boils down, quite honestly, down to poverty. When you have money, you can fix things as individuals. So I think the root of it all really is lack of economic empowerment. That's why programs for women empowerment is important, because when you help a woman, you give her a means to make money. You're not just helping her, you're helping her and her children, you're helping generations, etc. So it's, bottom line is just poverty. Poverty really is the root of all of these problems.
Now, you made mention that women are not encouraged to be economically empowered. I think there's a problem there because we've often heard this adage that says, once you empower one woman, you've empowered a wide range of others because she keeps touching lives. That is what makes us, the women, different from the male folk. Don't you think there's a challenge there? What should be done to ensure that this particular challenge is reversed?
Cultural, religious reorientation is part of it. Economic reforms to encourage women to be more economically independent, which I do know there are different programs, not just in Nigeria, but globally, that are being done. However, with the Buffett for, we usually do women empowerment programs, but let's look at it from a bigger picture. So if I come to, let's say, your village, yes, to do a women empowerment program, and you look at these are minimal skills most of the time. What do you NGOs usually do? It's teaching them how to sew, how to farming produce, how to things like that. So let's talk about sewing, for example, because we all wear clothes, we like clothes, we buy clothes all day.
Sure.
Now, in a community, let's say we have 100 women. Most likely more than 50 of them will say they want to be tailors. Okay, fine. So 50 are tailors. You look at the picture, so you have 50 tailors, and then you have, let's say, a population of 200 people. How many people will be patronizing those 50 women to sew clothes that will make them financially be independent? Then you have to, because that's something I've been talking about, we need to look beyond the scope of just training. How do I help your business promote it that you actually have clients? So you look at, there's so many initiatives out there, so many opportunities globally encouraging businesses and trying to support businesses owned by women. So for me, what is ideal when you look at a situation like that is it's not just teaching the women how to sew, but how do I help to promote their goods, not just from a national level, but a global scale. We're talking international here. How do I help their produce, they're not produce as in agricultural produce, but their products in relation to clothing, etc., jewelry, whatever, to be promoted, exported out of Nigeria? You go to Harrods, you go to stores, wealthy, high clientele stores abroad, and you will see, for example, baskets made from women in villages in Kenya, little basket that you weave, and they attach a little story to it, the name of the woman that made it, the village. It's sold for 1, 2, 3, 4, 500 pounds.
Wow.
Yes. And because it's made by women, they're promoting it. They want to buy it. It's just a simple basket. But so we need to look beyond the easy ways here for us in Nigeria. Because again, for us, for the nonprofit space, we don't pay, in quotes, taxes, because this is another issue we have with government. NGOs don't pay taxes per se, but so for example, if I train women to sew, that is, of course, I'm not generating revenue, but if I now teach them how to sew, or let's say use baskets, for example, I teach them how to make baskets, how to weave baskets, then I now take those baskets and sell them on their behalf. Now I'm trading.
Sure.
Even though the money is going back to them, but I am trading, so I must pay taxes on those products. So there are a lot of gray lines, fine lines that us from the nonprofit space don't really know, and it now becomes a problem with the law. Yes, but in order to encourage, in my opinion, properly encourage entrepreneurship beyond, for women, it's not just to teach them how to do something.
With the coronavirus now at the community transmission level, what is your assessment of the people's compliance that's looking at the level of adherence to the laid down COVID-19 protocols?
People are not, community levels, they're not adhering to those warnings. Most of them don't even believe in that the virus even does exist.
Shouldn't be a strange issue now.
And it cannot be only Nigerians.
We're working with the community, so educate us.
But also at the same time, even look at America. There are people saying that coronavirus does not exist. It's a mindset that some people simply believe some things and some don't. So you have people in the communities that say, no, it's a rich man's disease, a killer. It's not going to affect them. There are those that believe that as long as they drink the traditional herbs, the agbos, etc., roots that are saturated with alcohol, etc., that It's one source to cure all possible illnesses and diseases.
Oh, really?
Ailments. So there's a lot of distrust.
Should we attribute that to ignorance? But there have been lots of sensitization and awareness program going on.
There's a great deal of distrust in everything that comes out of the mouth of government. So a lot of them, it's not real. They're just looking for ways to make money, extort money. There are some that say, no, it's just simply rich people that die because they don't know anybody that's poor within the community that has died from coronavirus. But unfortunately, a friend of mine had coronavirus, COVID-19, and I asked him what, he's recovered now, and I asked him what the symptoms were, and he said it just seemed like a very, very bad bout of malaria, almost like typhoid. So it's easy to understand why it could be most likely in communities, rural communities, but they don't know what it is. They would think it's malaria. Do you understand? Yeah. And we're very good at self-medication because of the symptoms. And we're very good at self-medication. Anything you run to the pharmacy or the chemics or the local woman, you're drinking something. So it's, unless you go to, or someone does go to, or you are informed about certain types of symptoms, or you go and have a test done, people would have it and they have no idea that's what it was.
In recent time, the tradition and the social media have been awash with very distrustful acts of sexual assault, even on minors. Taking a critical look at it, what do you think might be responsible for this?
I don't think this is news per se in the sense that it's just starting as in sexual and gender-based violence. What I believe has brought it to the forefront right now during the COVID-19 is because of the quarantine, the whole stay-at-home situation.
People are idle.
People are idle, or you have free time to follow the news and go on social media, so you're seeing stories that you wouldn't have seen if you had to get up and go to work and deal with your daily affairs. And because people had different, I'm not in any way, shape, or form condoning it, yes, but different people had different ways and forms to vent out their frustrations and their sexual urges. Be it they had wives, or not probably wives, girlfriends, prostitutes, etc. Yes? Then being locked at home, they couldn't go anywhere. The sickness, because it is a sickness.
Because you're not allowed to move around,
correct,
especially during the lockdown.
During the lockdown. That perverseness now made a lot of people, in my opinion, because when you're sick, when someone is sick, mentally, psychologically sick, they're sick. They just went ahead and it's just been, pretty much a free-for-all, really. From hearing cases of children, babies, 3 months old being raped.
But Princess, should that really be blamed on the lockdown? What is our moral uprightness? Where has it gone?
I'm not saying I blame it on as an excuse. I'm just saying that the lockdown made us realize more what was happening, what has been happening.
Okay.
You know what I mean? If, like now, we're able to get up, leave the house, go to work per se now. So you can only check social media so many times a day or read the blogs or the news. But during the period of, 3 months we were at home, all we had was our phones and television. So everything was being reported. You couldn't miss anything at that point.
That's true. That's true.
With, it hasn't been only a matter of rape. You've had domestic violence. A lot of marriages have survived, in quotes, because the spouses barely saw each other during the day.
It's true.
The husband would get up or the wife get up, and then they've been patching and managing each other for years because they barely saw each other. But with the lockdown, there was no escape. So there's a lot of cases of physical assault, physical abuse, husbands beating wives, wives doing etc., stabbing, spousal. So there's been a lot going on. And there were not positive things at all, not positive things. So it's drawn all our attention to the fact that the society is in crisis and things need to be done. Serious things need to be done. As you know, there's been a lot of callings for stricter penalties to rape, etc. But the fact is there are laws already in place to penalize rapists. But the problem is the execution.
We'll take a short break now. I'll get back to you. Glad to know you're still there. Now, Princess, what exactly is your organization doing about these challenges, especially as the special advisor to the Deputy Senate President on NGOs?
In the midst of the rise of sexual and gender-based violence issues in Nigeria, the Deputy Senate President, Senator Obiageli, with his directive and also with the support of various chairpersons from the Senate and House of Representatives committees, I went ahead and had various consultation meetings with the ministries, the MDAs, in relation to, that have the legislative mandate to address issues in relation to SGBV, such as the police, Ministry of Justice, Ministry of Health, NAPTIP, Women's Affairs, Federal Ministry of Women's Affairs, etc., to understand exactly what the problem was, because there are a lot of discrepancies in relation to what their processes are. Because us from the nonprofit space, we're very interested. You have a lot of conversation going around the table in the nonprofit community about how to put funding to support the government's efforts to curb rape, etc. But it became an issue of where do we put the money to? Who are we supporting? What are we supporting? Everybody is, support us, But I had to sit with them extensively to understand what their processes were and identify what their challenges are, because you cannot come up with solutions without knowing exactly what the root problems are.
Exactly.
And I have to tell you, it was very, very depressing, because in my opinion, based on my findings, victims and survivors of rape in Nigeria are being raped in two ways. They're being raped by perpetrators and also by the system. I'll give you an example why. So you have, of course, within Ministry of Women's Affairs, you have a social welfare department. Off the bat, you can just imagine, based on your own personal interpretation of what a social welfare department should do. However, when you have a victim or survivor, rape survivor, and then they go to the hospital, because up front, a victim might think, okay, the first point of call is to the hospital if he or she is having some major bleeding, etc. And by the way, during this lockdown period of COVID-19, there were more adolescent boys raped than females.
Really?
Oh, yes. Yes. So you have a victim who go to a hospital. Then the hospital tells the victim, no, you have to go to the police station and get a police report. Actually, that's against the law.
So what does it law?
The Ministry of Health, yes, there's a health law, an act off the bat, I can't remember what it is right now, but states that no hospital or medical practitioner should refuse to offer any medical assistance to anybody, any circumstances. If they do, they can be fined 500,000 naira or go to jail or jail for 6 months. So it's actually against the law when you hear cases of people go to the hospital and they say, go and bring a police report, be it for a gunshot wound or any accident at all. What the policy says, not law, but what the Internal Ministry of Health policy says is that they should notify the police, not refuse treatment. So when we're talking about laws, number one, government is already breaking the law. I'm talking about I'm not even talking about private hospitals now. This is even government hospitals. So they get there. Of course, post-rape tests, etc., examinations have to be done. And the victims foot that expense.
Is that supposed to be so?
Good point. What does the Social Welfare Department and the Ministry of Women's Affairs, what is their responsibility? If rape victims have to pay for their own tests, I'm not talking about private hospitals, in government-owned hospitals. Most of them are so poor that even the police officers put money together to pay for them to do their tests. And what they do is, when they're opportune to catch the alleged rapist, in the past, they would tell the victims to come back in 3 months to see if he or she contracted any sexually transmitted diseases so they can start treating. But what they now do is to prevent the lapses and further trauma, health-related issues. When they have the alleged perpetrator, they also take him to the hospital and run such tests on him too. So if he is HIV positive, they immediately start treating the victim. And guess who pays that?
Who?
The victim. Because if the alleged rapist says he doesn't have money to pay for this test, it's now the responsibility of the victim to pay for his or her own medical examinations and that
but
of
if
the
the
rapist.
perpetrators are caught, I think they should be made to pay for all of that and not the victim.
I agree, but if the person says he doesn't have money and it's the life of the rapist, the rape victim, it's not a matter of allowed or not allowed. If the rapist has HIV and says he doesn't have money to pay for his tests, or not even if he has or doesn't have, potentially, let's assume, this assumption that he has some form of STD, and the rape victim is trying to save his or her life, number one, has already been traumatized from being raped. That's even one issue.
Yes,
and then to make sure that he or she has not contracted some sort of disease, it is in the interest of the victim to pay to make sure that he or she has not contracted something even more from the rapist. So why would victims, rape victims, pay for their post-rape kit examinations in government-owned hospitals, where you have the police and it's clear that, yes, this person, he or she has been raped? Yes.
Okay, now, no doubt the family is the bedrock of society. What should be the role of parents, guidance, traditional leaders, and even religious bodies in educating this bad culture, in eradicating the bad culture from the society?
How do you reform a people that will make excuses for bad behavior and beg you to forgive someone that has done wrong rather than punish the person that has done wrong? It's the devil that did it. So let's talk about within this rape space. It's the devil that made him, oh, please forgive him. It's the devil that made him rape a 2-month-old baby. You are wicked, you're not understanding. They are encouraging and promoting bad behavior. And who will do this? It will be the traditional leaders. It will be the community leaders. It will be the family members. Because when they come to beg, they come as a clique. They come as a pack. And they will come with people that they believe you cannot say no to. There's no way around it. Yes. So when you talk about even family members, there was a case in social media of a woman that reported to the police her neighbor that raped her 8-year-old daughter. What happened? Her husband and his family members kicked her out of the house because she brought shame to their family by reporting their neighbor. The father of the victim
Kicked the victim out?
Kicked his wife out because she reported their neighbor that raped their 8-year-old daughter.
Now, but you know that there is a limit to which organization and other non-governmental organizations can go in curbing this menace. What, in your opinion, do you think the government can do to tackle this problem?
They need to be serious about tackling the problem. And I honestly think that to really resolve the issue, there need to be more serious consideration and conversations in relation to establishing laws, accommodating people's religious and cultural beliefs. Do you understand?
Yes.
It's important. You cannot, based on my belief, you cannot tell me if I feel it's okay to do something and you now, because you feel it's not, that's what takes precedence. So there needs to be a lot of conversation. That's why the Child Rights Act has not been adopted by a lot of northern states, because it goes against what is firmly believed. So they need to have such dialogue. If the Constitution says that 18 years old, based on global best practices, is what is legally consentable as adults, sexual intercourse, etc. But if someone's religion says 15 or 16-year-old is okay, we're all citizens of the Federal Republic of Nigeria. They need to look at both sides and negotiate and see what it is. What works in the West doesn't necessarily work here. Do you understand? If you're not being realistic about what it is, you cannot throw away traditions. You cannot throw away culture. There's a part in the Child Rights Act that says you cannot put marks, tribal marks, and tattoos on children. It's a crime. But that's our culture. A lot of things should be carefully considered, realistically and domesticated. Don't bring what works in America and think it's going to work in Nigeria. Do you understand that?
Sure.
They have to carefully look at it. Even if it's okay, fine, 18 might not work for you based on your religion, then okay, how do we negotiate this? Where do we say is legal age of marriage? Do you understand?
Yes.
But bottom line is, if there are going to be serious changes, proper, realistic changes in Nigeria, we must consider and respect each other's religions, traditions, and cultures, while embedding, incorporating Western beliefs and laws, etc., and global best practices, and come up with what works for us. We must domesticate all of these issues. And I'm sure these are some of the challenges at National Assembly, even coming up with even the Child Rights Act and all of these things, but we must, we can't do the ostrich approach and bury our head in the sand and act as if these are not major issues, because they're major issues, and we all have to agree on these issues for us to be able to move forward, for the traditional leaders, rulers, etc., to be able to speak with authority. Because we know that at least your beliefs and traditions and cultures and practices are respected in the conversation. I think that that's really the way to move forward.
Thank you very much, Princess Modupe Ozolua. I must confess, it's been a very insightful discussion, and I must sincerely appreciate you for coming on Frontiers.
Thank you for having me.
We've been looking at the rising cases of sexual assault, especially amid COVID-19, and our guest has been Princess Modupe Ozolua. Coronavirus is real, so ensure you observe all safety protocol. Wash your hands frequently or use the hand sanitizer and the face masks. Thanks for your time. I am Obiageli.